Hello and welcome to our Emergency Medical Service or EMS training program. In this video, we will provide an overview and introduction to the EMS field. This video is intended to supplement any readings or coursework assigned by your instructor. The learning objectives for this module are: define emergency medical services, identify milestones in the history of EMS, and list the critical components of an EMS system. So what is EMS? According to EMS.gov, EMS is a comprehensive system of coordinated response involving multiple people and agencies that provide emergency medical care. EMS is activated by a call for help after an incident of serious illness or injury. EMS providers respond and are trained to initiate treatment based on their assessment and protocols in an out-of-hospital or pre-hospital environment. A solid EMS provider must possess good judgment, the ability to think critically, and have excellent decision-making skills. At the federal level, the Office of EMS is housed within the U.S. Department of Transportation, or DOT, at the National Highway Traffic Safety Administration, or NHTSA. Established by the Highway Safety Act of 1970, NHTSA was developed to carry out safety programs under the National Traffic and Motor Vehicle Safety Act and the Highway Safety Act, developed in 1966. The NHTSA mission is to support comprehensive EMS system development and improvement and to serve as the lead federal coordinating agency for technical and policy expertise on EMS systems and 911. Additionally, every state operates their own Office of EMS, with many of those being housed in their respective state's Department of Health. The image seen on the right of your screen is called the Star of Life. Recognizing the need for a clear symbol to represent this critical public service, NHTSA created the Star of Life back in 1973. The image was adapted from the medical identification symbol of the American Medical Association. Each bar on the Star of Life represents one of 6 EMS functions: detection, reporting, response, on-scene care, care in transit, and transfer to definitive care. The serpent and staff symbolize the staff of Asclepius, who was recognized as the god of medicine in ancient Greek religion and mythology. Overall, the staff represents medicine and healing, with the skin-shedding serpent indicating renewal. The Star of Life has become synonymous with emergency medical care around the globe. This symbol is a means of identification on ambulances, emergency medical equipment, and on uniforms worn by EMS clinicians. EMS integrates with other services and systems intended to enhance the community's health and safety. As seen in the pinwheel graphic here, EMS operates at the crossroads of healthcare, public health, emergency management, and public safety. Because EMS clinicians respond to all kinds of emergencies, we frequently work side by side with our public safety colleagues in law enforcement and the fire service, with our primary mission of providing emergency medical care. EMS is an intricate system that includes the following components: public and private agencies and organizations, communication and transportation networks, hospital and specialty care centers, rehabilitation facilities, and trained professionals who include volunteer and career pre-hospital personnel, dispatchers and telecommunicators, physicians, nurses and therapists, and administrators and government officials. EMS also includes an informed public that knows how to identify an emergency, activate 911, and render aid until additional resources can arrive. Specialty healthcare systems play a pivotal role in providing specialized care for various medical conditions, ensuring patients receive the highest level of expertise and treatment. Trauma centers stand ready to handle the most critical injuries, ranging from accidents to violence-related trauma. These centers are staffed with highly trained medical professionals who are skilled in rapid assessment, stabilization, and surgical interventions. Burn centers offer specialized care for patients who have sustained significant burns. They provide comprehensive treatment from initial emergency treatment to long-term rehabilitation. Using state-of-the-art facilities and a multidisciplinary approach, burn centers not only focus on wound care and surgical interventions, but also provide emotional and psychological support for patients on their journey to recovery. In the realm of cardiac care, specialized facilities are dedicated to the diagnosis and treatment and management of cardiac conditions. These centers utilize advanced technologies to provide prompt interventions for acute cardiac events. Additionally, they provide comprehensive cardiac rehabilitation programs to enhance recovery and prevent future cardiovascular complications. Similarly, stroke care facilities offer specialized expertise in the rapid diagnosis and treatments of strokes using cutting-edge imaging techniques and interventions. These centers prioritize swift action to minimize brain damage and facilitate optimal recovery outcomes. Pediatric specialty care facilities specifically focus on the unique medical needs of children, offering a nurturing environment that's staffed with pediatric specialists from across various disciplines. From neonatal intensive care to pediatric oncology centers, these facilities deliver specialized care to ensure the well-being and development of young patients. Much of modern-day EMS has evolved from various military conflicts. During the American Civil War, Major Jonathan Letterman established the U.S. Ambulance Corps within the Army of the Potomac. Ambulances were stationed close to the front line to respond to reports of wounded soldiers regardless of which side of the conflict they served. The injured soldiers were triaged by the severity of their injury and transported to appropriate levels of care. This system of emergency medical care was adapted for civilian use in Cincinnati, Ohio in 1865 and later in New York City in 1868. These services utilized horse-drawn carriages as ambulances. Later in World War I, wounded soldiers on the battlefield used signal boxes to summon medical help. As seen in the image here, ambulance services used steam and gas-powered ambulances to transport the wounded soldiers. In 1928, in Roanoke, Virginia, the first rural rescue squad was launched as the Roanoke Life-Saving and First Aid Crew. Other states followed, but the quality and types of service varied considerably as there was no national standard at the time. Training during this time was limited, and much of the care provided, including loading the victim and providing rapid transport, also referred to as the scoop and run model of care. During World War II, specially trained military corpsmen provided care in the field and transferred the wounded to care stations that were staffed by nurses and physicians. In 1951, during the Korean War, helicopters were used to transport the injured to mobile Army surgical hospitals, which helped thousands of soldiers and civilians survive their injuries in that war. This was the basis for the 1970s television series, MASH. Modern EMS evolved from the 1966 National Academy of Sciences study titled Accidental Death and Disability, the Neglected Disease of Modern Society. This document is more commonly referred to as the White Paper. This report revealed the inadequacy of pre-hospital emergency care and transportation in many areas across the country. Subsequent federal legislation standardized training requirements and introduced the term emergency medical technician. In 1973, the EMS Systems Act established EMS systems throughout the country and created funding sources and programs to develop improved systems of pre-hospital emergency care. The DOT adopted training curricula for EMT, EMT paramedic, and first responders. New rules also established EMS radio communications and introduced ambulance specifications. In 1984, through support from the American Academy of Pediatrics and the Surgeon General, Congress enacted a law that authorized the use of federal funds for emergency medical services for children, or EMSC. The EMSC program obtained funds to improve the pediatric capabilities of existing EMS systems and placed an EMS emphasis on how to care for children and prevent pediatric injuries. 30 years after the White Paper was published, another important document called the EMS Agenda for the Future was published in 1996. The EMS Agenda for the Future provided an opportunity to examine what had been learned during the 30 years prior and helped to create a vision for the future. In 2001, the National Association of State EMS Directors collaborated with NHTSA and other federal partners to develop a national EMS database called the National EMS Information System. NEMSIS, as it is commonly referred to, provides a framework for collecting, storing, and sharing standardized EMS data from across the country. This helps local, state, and national EMS stakeholders more accurately evaluate EMS needs and performance, as well as support better strategic planning for EMS systems. On the last slide, we recognize the 1966 White Paper as the beginning of modern-day EMS. From this document and subsequent establishment of NHTSA under DOT, the first EMT curriculum was developed in 1971. In 1975, the University of Pittsburgh and Dr. Nancy Caroline began work on the first nationwide paramedic training course, which was released nationally by NHTSA in 1977 as the EMT Paramedic National Standard Curriculum. In 1980, the first EMT intermediate exam was offered by the National Registry of EMTs. In 1985, the DOT released updated national standard curricula for both paramedics and intermediates. In 1994, the DOT released a revised version of its EMT ambulance curriculum and changed the name from EMT-A to EMT-B, which stands for EMT Basic. NHTSA released the EMS Education Agenda for the Future, a systems approach, more commonly referred to as the Education Agenda, in 2000. This document provided a consensus vision for the EMS education system of the future. The national agenda described the elements of an educational system that included 5 key components: National EMS core content, National EMS scope of practice model, National EMS education standards, National EMS education program accreditation, and National EMS certification. In 2007, NHTSA released the National EMS Scope of Practice document that provided a national guideline to define levels of EMS licensure, guide state legislation, and promote reciprocity between states and clarify EMS roles for the community. This document defined the 4 nationally recognized levels of pre-hospital care, which are emergency medical responder, emergency medical technician, advanced emergency medical technician, and paramedic. In 2009, NHTSA released the National EMS Education Standards document that outlined the minimal levels of competency for entry-level EMS personnel to achieve within the parameters outlined in the National EMS Scope of Practice model. This document was later updated in 2021. The National EMS Clinical Guidelines Project was initiated by the National Association of State EMS Officials in 2012 and produced 3 versions of model clinical guidelines for EMS. These guidelines were created as a resource to use on a state, regional, or local level to enhance pre-hospital patient care. Many current state EMS protocols were modeled after these clinical guidelines. As EMS education continues to advance, these documents will continue to be updated to reflect advances in medical care and the increasing scope of practice of pre-hospital care providers. In 1972, a landmark TV series called Emergency aired on NBC television. This landmark program introduced the United States to the concept of paramedics. The show focused on 2 Los Angeles County firefighter paramedics, Roy DeSoto and Johnny Gage, who operated under medical control from the fictional Rampart General Hospital. In the image on the left, we see the primary cast of the TV show. The image on the right is Rescue 51, also commonly called Squad 51, which is the paramedic response vehicle used on the show. Squad 51 is an accurate version of the paramedic rescue squads that were used in LA County at that time. Paramedics would respond and initiate emergency care on scene, and they transported with the patient in a private ambulance. Many early paramedic systems were called MICUs, which stand for Mobile Intensive Care Units. Emergency was technically accurate for its time because every script was fact-checked and approved by technical consultants Dr. Michael Criley, who created the LA County Fire Department paramedic program, and LA County Fire Department Battalion Chief and EMS visionary James O. Page. So why are we talking about a television series from the 1970s in an EMS course? This series is credited by many to have contributed to the growth of paramedicine as a profession in this country. In fact, many paramedics who started their careers in the 1980s and beyond, including myself, credit emergency as their introduction to the world of EMS. This brings us to the end of our presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you struggled with. Thank you for watching this learning module, and good luck on your journey as an EMS provider.